Hi, well, welcome back to my journey. I know this is like my only second video that I've made so far, and when I left off last time, I had really talked about my trip to the emergency room, my diagnosis, my emergency brain surgery. So there was a lot to communicate in that last episode, but now I just kind of wanted to go on from there. Well, what happened post surgery, and what the next steps looked like in my journey. So I think uh, I spent about a week recovering in the hospital before they would let me go, and then after that, I came home, spent a good another solid week at home, just kind of trying to get caught up on rest from being in the hospital for a week, and then I started with all the doctor's appointments. I started having to connect with various doctors, whether it be the oncologist or my general practitioner or the radiologist, there were the surgeon, just lots of people for the next week or so, uh, probably almost the next 2 weeks from the recovery time on after leaving the hospital. So it was a pretty busy couple of weeks immediately leaving the hospital, and and as I approached New Year's Eve, they wanted me to go in for another MRI. So I only had one MRI, and that was the one immediately uh, prior to surgery. And well, I said I only had one, so let me back up then. I only had two. I had one immediately prior to surgery and then one after surgery so that they could see a before and after of what had gone on. And I do have some of those images that I'm going to share with you, just for context. What everything looked like. Obviously, I didn't see some of that imagery before or immediately after. So I saw some of this much later, and I was just very surprised to see what had been going on in my brain. But that being said, the one post well post surgery around New Year's Eve, so it had been a couple weeks now at this point. I was looking at it, and as I was trying to identify what part of the cancer was still in in there and where it was, and there were just some abnormalities, and I thought they had explained that there could be some swelling, and so some of the images could be distorted, and because of the swelling. But as I was looking at it, it looked like there were just big pieces of my brain missing. And it wasn't until I was able to speak with the radiologist later that I learned that, yeah, that indeed was brain tissue that was missing. And so I was just shocked at the large segments of the brain that were no longer there. Initially, I had kind of been under the understanding that the tumor was sitting, or I guess the multiple tumors were sitting close to the surface of the brain, just under the skull, and so they were easy to get to, and that a good segment of the brain would be unaffected. But apparently, once the surgeon got in there, they noticed that the cancer was, seeping into the brain and was taking over that. So to the best of their ability, they needed to remove as much as they could without affecting my brain function. So they took what they could in areas where they knew they could that would have a minimal impact on my ability to, obviously, I think I said last time, just speak and process and exhibit physical activity, things of that nature. But it was just shocking to me having that kind of understanding and then seeing the big gaping hole that now exists within my brain. And so sometimes they probably don't share that thing with you because they don't want to shock, disturb, or upset people. But it's very shocking and upsetting sometime later when you're realizing, wow, that's not the picture that had been painted for me. So, I mean, did it ultimately change anything for me? Not really. I think I some of the questions that have come up for me have just been, well, what's missing now? Like, so obviously to have that much brain mass gone, what am I unable to do now that I could before? What was being processed in that segment of my brain that obviously isn't there, so it can't be processed anymore? Because I've felt pretty good overall since getting home from the hospital. I've been taking walks. I've been able to, do things around the house, exhibit all kinds of like normal, what I would consider physical activity. My memory has seemed pretty sharp for the most part. Like I remember details of conversations with the doctors that sometimes my wife doesn't even remember. Um, I I can remember things from the past, and so there's a lot of clarity there. Maybe I sound horrible. Maybe as you're listening to me, it sounds like I'm drunk and I'm just having trouble articulating words. I don't know. To myself, I don't feel like that's happening, but maybe there are things there that other people would look at and say like, wow, there's something off about him. Um, so I have to lean on other people for that kind of perspective. But I keep being told by doctors and the people I go in and see on a regular basis, and even some friends and family that see me all the time, that say, wow, you sound and look great. So, I have to take them at their word. But, uh, but anyways, I think for me, that was, a little bit surprising just seeing that MRI scan. But at that point, we met with the oncologist and the radiologist, and we talked about kind of what the next steps were going to be looking like and what their standard of care was that they were recommending. And now, when they use the term standard of care, they're saying this is how we pretty much treat people in your situation. And we do this because it's been clinically proven that these things work the majority of the time. Now, do they work 100% of the time? No, no, they don't. And they're not really quick to share that with you. There are some patients who do not respond, or some patients who respond in negative ways. So you kind of have to dig deep and ask questions on those points. You can't just take the doctors at face value. You have to do your own digging also, like through web searches and hearing some of the other stories out there, because they ultimately believe in this course of treatment. They believe that the majority of people are going to respond to this prescribed treatment, and so they want you to take it. They feel like it's your best option. So they are ultimately looking out for you in that respect, but they leave a lot of things off the table. And that to me has been a little bit of a surprise as well. And it shouldn't be. It really shouldn't. I've seen enough with other areas where doctors are a little bit tunnel visioned and only believe in one course of action, and it's not always beneficial to people. So I'm a little surprised that I didn't maybe I wasn't a little bit more skeptical. But their standard of care, ultimately, the oncologist said to me that you have an aggressive cancer, and so we need to treat it aggressively. We can't really waste a lot of time. We can't play a lot of games with it. We can't be too experimental, because this aggressive cancer is doing nothing but growing every day. It's what it lives for, and so we need to. I think he kind of put it like we need to punch it back a little bit and hit it hard, so that it is not as aggressive. and their prescribed treatment will do that. So what's their prescribed treatment? Well, he wants to do 6 weeks of radiation. So, and that's 7 days, or I'm sorry, that's 5 days a week, Monday through Friday. So every Monday, Tuesday, Wednesday, Thursday, Friday, I would be going in and having targeted radiation on that cancer area. So I had mentioned that there was one tumor that remained. Ended up finding out a little bit later that there was one tumor that remained that they couldn't get to. So obviously that's an active cancer area. But also there were some edges to the other tumors that they did get out that were they couldn't go any farther. So that cancer from those tumors had kind of spread into brain tissue that they couldn't touch. Now, they didn't really explain why they couldn't touch it, other than just that it would affect my physical abilities or my cognitive abilities. That it was critical brain tissue that if they removed it, I would see some kind of serious negative side effect from it. So for them, it was better to leave it and to treat the cancer that was in that tissue than to pull it out. So there's the one tumor that they couldn't get to, plus there's these kind of residual outlying edges of maybe one of the other two tumors that they did remove that still has some cancer active in it. So when they're treating with radiation, they're targeting that one tumor and then these outlying areas of active cancer to blast it with radiation. Apparently, tumors, cancer, can't survive under this radiation, so it does do serious damage to the cancer cells. So my first question was, well, then why can't we destroy the cancer altogether? And haven't really gotten a good answer on that. So if there's somebody out there that maybe has received an answer from a radiologist or an oncologist, please share in the comments. I'd love to hear what you've been told. I've done some research, and I'm not in the field, so I'm not finding a lot of good data. I'll keep asking my doctors to kind of clarify, but sometimes I feel like they just don't want to get too deep into the weeds. They just want to treat the program the way they want to. But ultimately, so that's 5 days a week for 6 weeks, going in for daily radiation treatment. And then the other part of their standard of care was to give me a chemo pill called Temodar. Supposedly it's a much milder form of what would be considered normal chemo treatment, where you go in for a period of time and you have to sit and get hooked up, and you kind of get hit with a much stronger chemo dosage. But this is a milder form. It's more conducive to my specific brain cancer, but very highly effective. And didn't find out until sometime later that it also genetically works really well for somebody like me who has a genetic mutation called TMHFR. It's just a genetic mutation that makes certain things kind of not good for me. Happens to be some processed foods and things like all the folic acid that they add to breads and things of that nature. Actually not helpful for me, but that particular gene mutation makes me more receptive to the Temodar. So they said that the likelihood of me responding well to the chemo treatment is actually good. So, kind of interesting how, I've talked in the past about how God's working and how He works in details in ways that we don't always see. Giving me a gene mutation that kind of has a negative impact on one aspect of my life, but in another aspect, it's a positive. So, I'm going to do some more research on that, which my wife and I started when we first learned all of this. And hopefully, we'll have more information in the future to share with you about it. But ultimately, that's that was their standard of care. So daily chemo pills, 7 days a week. Don't have to go in for it. It was just a prescription, and I'll pop that pill every day. The one thing that was, I guess, a little concerning was that his when we asked, okay, so we have 6 weeks of radiation. What about the chemo? When does it stop? And he said, yeah, it really doesn't. So that, again, kind of a little bit of a surprise. So you want me to be taking the chemotherapy then indefinitely? And he was like, yeah, you'll be doing it unless something changes. Um, Maybe unless I'm able to get into some kind of a clinical trial, or um, if I start to see negative side effects from prolonged exposure to the chemotherapy. So, so if I start to experience negative side effects, then they'll have to take me off of it. But he would say that that won't be good because ultimately the cancer then will be unchecked. So that's their standard of care. And I did some additional research, really with the help of my wife, who's just great at researching this kind of stuff. It helped through the radiation process to strengthen me. And so I have tons of information on that as well. And also, I think looking at other things that we could do maybe long term. So let's go ahead and start with what the doctors are recommending. I mean, I have an aggressive cancer that's seeking to wreak havoc on my brain, and we need to do something. We know that if we just sit by and do nothing unchecked, that it will overtake my brain. So we have to do something. But that doesn't mean that we have to do what they prescribe long term if it doesn't have a long term benefit. And so we've really been looking at alternative treatment plans, ideas, things that we can do that will either help make what they're doing better for me, and or more sustainable long term, or other things that we could use to replace the chemotherapy long term. So I have a lot of information on that as well. So looking forward to sharing what I've learned. And again, if you yourself have been through some kind of a brain surgery or brain cancer, and you have things that you've tried and done that you feel are effective, I'd love to hear about it. If you didn't have brain cancer, but you've had some other form of cancer, please feel free to share your story as well. I don't want to exclude you, but I do think it's important, especially for people who are listening who have never had cancer. It is pretty clear that each cancer is different. And sometimes cancers within their own realm, like brain cancer, can have different genetic codes that mean that they respond differently to different kinds of treatment. So just because somebody had skin cancer and they did something, or they had breast cancer and they did something, doesn't mean that it'll work for everybody who has a form of cancer. So it's just important to understand that, and make sure that you do your research when people recommend things to you. Some things do carry over, so I'm trying not to say that not all recommendations or ideas are bad. but it's just something you do have to look into and make sure that you know what you're doing before you start treating yourself. Because the doctors will pretty much not support anything that doesn't fit their standard of care. And but just to wrap up, because I realize I've kind of rambled a little bit long on this video, um, and then on the following video, I'll get into some more of some of the side things that we've done. But it's one of the things that surprised me is that when I asked my oncologist, hey, what can I do in the meantime? So I know I have to wait until I've kind of recovered a bit from my surgery before I can start treatment. And they said, yeah, there's not much you can do. We just have to get you well enough to where we can start treatment. And I said, are you sure there's like nothing I can do? Like even diet wise, that would be beneficial to the fact that I'm currently have an active cancer growing in my brain, but I can't start beating that cancer down. So there's nothing I can do. And they said, no, really nothing you can do. There's nothing clinically proven that you should be wasting your time on. So again, I'm didn't go to school. I'm not an oncologist, not a brain surgeon. There's a lot of things I don't know in the medical world. So I just took him at face value, and I went home, and that's when we began our research into options. And I was surprised to learn that ultimately cancer thrives from glucose. So glucose in our bodies, sugar, is like gasoline on the fire of the cancer. So I was really surprised when he didn't tell me cut all sugar out of your diet. It just seems like I think my wife even specifically asked when it came to food, should I not eat certain things? And he responded with like, I think he should eat whatever he wants to eat. And looking back, I feel like, well, that's pretty much what you say to somebody who's going to be dead in a couple days. And so, yeah, if nothing can be done to change their inevitable outcome, they should just do what they want to do, what's going to make them happy, because in a couple days it won't make a difference anyways. But that wasn't the prognosis I was given. So I was a little surprised that I wouldn't be warned that sugar would just be, fueling the fire of that cancer in my brain. And so stay away from it. So when I discovered that, I immediately cut all sugar out of my diet and did some other things as well that were going to help. And I'll talk about that a little bit more on the next video. But just wanted to link that together with what I was being told and how I felt like I didn't really get the full picture from the doctor initially on what was going on and things that I could do to make a difference. So anyways, I'll go ahead and end there for now. And thank you again for your time. And in the next video, I'll kind of get into some of the things that I learned on alternative treatments and and then kind of starting the process and what that looked like. So thanks again, and I hope you all have a blessed day.